Next up is, if I say it right, Lily Kuechle, correct? All right, I'm doing good. All right, here you go, dear.
Thank you guys so much for being here today. It is amazing to see so many people in this room all here to talk about one of my favorite things to talk about in the world, which is naloxone. So today, this part of the training is going to be the naloxone training. So we're going to talk about myths and facts, dispel any misinformation, see what you guys already know. Then we're going to go risk factors for an overdose, so things that increase or decrease a particular person's risk. Then we're going to go to how to recognize an overdose, signs, symptoms, physical features as well, and then how to respond. We're going to go over rescue breathing, recovery position, and what to do. And then finally, we are going to get into what exactly naloxone is, how it works, and why it's so amazing. So go ahead and shout it out. What do you guys think? Myth or fact? The availability of naloxone encourages drug use and discourages people with substance abuse disorders from seeking treatment. Myth. That is definitely a myth. So death keeps people from seeking treatment, as Amy Jo has said, and as many people up here have said. Basically, we think of naloxone as a way to give people one more chance, or two more chances, or three more chances, or however many chances it takes to get the help that they need. You just never know, and dead people can't get help. So, next up, we've got naloxone is another drug that can be abused. Myth or fact? Myth. Naloxone is like the opposite of a drug you can abuse. It is safe and effective, it has no addictive potential whatsoever, and it does not get you high in any way, shape, or form. The exact opposite, actually. All right, myth or fact? Overdoses are more likely to happen in long-term users. Fact. So they actually happen much more often in longer-term users, especially folks who've been using for 5 to 10 years or more. And we'll get into why that is in a little bit. I'll keep you in suspense. Naloxone is self-administered. Myth or fact? Myth. Yeah, if you're at the point where you need naloxone, you are not going to be able to give it to yourself. That's why it's so, so important one is here today, so that if you guys do have contact with folks who are using opiates, you guys are the people that are going to be able to help. They're not going to be able to help themselves. All right, next is naloxone is dangerous if, oh, there we go. All right, this is a myth. Naloxone is not dangerous to ingest for anyone. Children, pets, pregnant women, doesn't matter. Again, if they're overdosing, naloxone is their best chance to stay alive and seek the treatment that they need. Okay, last one, I think. Naloxone will not work if the person overdosed on something other than an opioid. Myth or fact? Fact. So that includes things like benzodiazepines, and sometimes those the overdose symptoms can look kind of similar, but Narcan will not work if somebody has overdosed on something like Xanax, Valium, diazepam, bath salts, cocaine, methamphetamine, or alcohol. Yes?
What if they took opioids and benzos, for example? Stop with that.
Well, naloxone can't hurt in that case. Yeah. It's if there is a combination of things, at least it'll help with the part that naloxone can help with, and we'll get into this in a bit, but hopefully EMS should already be on the way at that point, and they will have more tools than we have in order to help people stay alive. All right, we got a few more here. If you're using with someone and they start overdosing and you call for help, you will not get arrested. Fact, sort of. We'll get into the nitty-gritty of that in a little bit, but basically it provides immunity from drug-related charges under Oregon law. There are a few exceptions to that, but if in doubt, call 911, please. Naloxone is difficult to get. I feel like I need to take this one off because every time I'm here, we're just giving naloxone away. What do you think? Myth. So you can get naloxone here at Clackamas County. You can get it from us at Northwest Family Services, but we also get it from Clackamas County. So you can get it from any pharmacy. And if you have any clients or if you are on OHP, you get 1 free dose per year. No questions asked. So that's a great resource for folks, and a lot of people don't know that. So this is the nitty-gritty on the Oregon Overdose Good Samaritan law. Essentially, it provides immunity from certain types of offenses, namely drug-related charges. So possession with or without the intent to distribute, and being in a place where drugs are used, and then as well as warrants, parole violations, and release agreement violations stemming from those charges. It does not provide immunity from being arrested for any other kind of crime or parole violation, any new kind of crime not listed above, or any out-of-state or federal warrants of any kind. That being said, we still really encourage people to call. The police are probably not going to arrest them. They can, and we like to tell people that because it is a little more complicated than it appears, but it is really very important that that will be taken care of. Saving somebody's life is the most important thing. So here are a few common risk factors for overdose. The first one is mixing substances. So if you're mixing uppers and downers, they may cancel each other out a bit. If you're mixing 2 downers, you might feel like the effects are not quite, that like they're worse. And it just can be kind of hard to tell exactly how much you've taken. And that can often lead to folks overdosing. Having a reduced tolerance is also, and April touched on this earlier, a very large risk factor. So folks who are coming out of rehab or jail or who have been sober for a while and then go back to it, oftentimes they'll take the same amount that they did before. And if your tolerance is down, that can lead to an overdose. Unfamiliar supply, changes in quality, new dealer, fentanyl, all that stuff, that definitely increases folks' risk for overdose. And having someone else inject you, you don't know how much you've taken, again, exactly, you don't know how they mixed it, all that. And then finally, using alone. So we want to, if anybody here knows anyone who is an active user, please do encourage them to use with someone else because, again, naloxone is not a self-administered treatment. So if they do overdose and they're by themselves, there's not going to be as much help for them as if someone else was there. There we go. All right, so now we're going to get into how to recognize an overdose. So this is a really common misconception among a lot of folks where people, they've seen in movies where people inject and their eyes immediately roll back in their head and they like fall to the ground. That's not always how it goes. It can be a lot more gradual and it can take a lot longer than folks think. It can take anywhere from 1 to 3 hours for after somebody has taken opiates for the effects to be felt fully, and they can overdose as long as 1 to 3 hours after they've actually ingested the drugs. So, other risk factors for overdose include blue lips and nails, because as you guys may be aware, the opioids affect the respiratory system. So it basically shuts down your ability to breathe for yourself. Some of the first things that come that show up with that are going to be blue lips and nails, just because that's where the most blood vessels are closest to the surface. So have an eye out for that. You want to make sure they're completely unresponsive. So if they're even talking a little bit, they're probably not quite ready for Narcan yet. That doesn't mean that they won't be, but you want to shake them. Hey, hey, are you okay? Tap them, call their name, give their shoulder a squeeze, try and rouse them. If you can't, then that's a sign that you may need to go and find your Narcan. And then this is another common misconception. Basically, a lot of people think that people just stop breathing, but even shallow, slow, gurgling, or snoring sounds can also be a sign of an overdose. So even if it sounds like they're making breathing sounds, that doesn't necessarily mean that their brains are getting enough oxygen. So with that in mind, if my pointer will work, the first thing you're going to want to do after you find someone you think may or may not be overdosing is you are going to want to make sure that the area around you is safe. So we want to make sure that it is a safe place for folks to render aid, that there's no hazards around. You want to check for broken glass, needles, aggressive dogs, traffic, all sorts of stuff. That's very important to make sure that you're not getting injured because, as Amy Jo I'm sure will tell you, 2 injured people is way worse than 1 injured person. So after you've done that, you want to attempt to wake them. Hey, are you okay? Squeeze and tap, verbal and physical attempts, and then you want to check for breathing. So 3 ways to do that. You want to look, you want to see if their chest is rising up and down. You want to listen, so you put your ear down, you listen for their breathing sounds over their nose and mouth, and then you want to feel. So you can either feel for their breath on your ear when you're listening, or you can put the back of your hand in front of their mouth and see if you can feel any kind of breathing going on. If you can't, you're going to want to immediately call 911 and put the phone down on speakerphone. That way you have both hands free and can do whatever the folks on 911 tell you to. The next thing is to provide rescue breaths. So to do that, you want to check the airway, have a little peek, make sure there's no gum, food, anything in there. Their head back, and then you'll pinch the nose and give short breaths, about 5 seconds long, every 5 seconds. So you're going to want to continue that for approximately 30 seconds. And then you will administer the Narcan. So if folks don't know what it looks like, I have an example right here. It's a little bit hard to see. These are what's in your kits under your chairs. But this is what it looks like. Basically, it looks like an allergy spray that you would put up your nose. So there's a plunger, and then there's a little bit of a tank. And then there's a piece that is inserted into the nostril. So once you've provided some rescue breaths, making sure that they're getting enough oxygen because that is the most important priority for you, you're going to tilt their head back, put the plunger in their nose, push the plunger down, and keep that head tilted back so that all of the medication gets into the right area and can be absorbed rapidly. So after that, you are going to want to continue providing rescue breathing for 1 to 3 minutes. That's about how long it takes for the naloxone to take effect. It works remarkably quickly. And then hopefully at that point, they should be coming around and EMS should be arriving. If they're not, and you have another dose of Narcan and they are still not responding, you can administer the second dose after 5 minutes. So hopefully that will do the trick. They will wake up. You will tell them you overdosed. I administered Narcan to you. And then you will hopefully be able to encourage them to go with EMS to seek treatment. But if you cannot, it's very, very, very important to stay with that person for anywhere from ideally at least an hour to 6 hours because they may go back into overdose after you Narcan them. So essentially, the effects of Narcan are much shorter than the effects of opiates. So even if you give them a couple doses of Narcan, those are going to wear off within about an hour. And then after that, they may go back into overdose again. So making sure that that folks are not alone after they've been given Narcan is very important. So Naloxone is a safe antidote to opioid overdose, and it has no risk of dependency whatsoever. Basically, the way it works is you have receptors in your brain that really like opiates. So they bind to the opiate molecules, and that's what creates the high, that's what creates the pain relief effects, everything related to the effects of opiates. And what naloxone does is that molecule actually has a way of binding to those receptors in your brain that is stronger than the opiates. So they go in, they kick out the opiates, and then they are blocked. Those receptors can't be accessed by those opiates for about an hour. That's why it works so quickly as well. So obviously this is not going to make you high. This is going to kick you from being very, very high into very, very, very withdrawn within 3 minutes. So it's not a very pleasant experience. It's not something people seek out. It's not something they want to do. People don't do this for kicks. It's truly a miserable, miserable time, but it's better than dying. So another important thing I wanted to teach you guys about today is the recovery position. So that's what's being shown in this photo here. If you do have to leave someone for any reason, this is a really great way to make sure that they're not going to die and reduces the chance of that. So essentially, we don't want people to inhale their own vomit. And so if you do have to leave someone alone, you want to get them onto this position. So one hand under the arm, head placed on the arm, other hand underneath, like so. And then you want to put them on their side and then put the legs so that they stay on their side. So stagger the legs, bent like in this position. So what you want to do is after they wake up, you are going to want to explain to them what happened. They may be very disoriented and confused, perhaps a bit agitated. You might need to repeat yourself multiple times, but just having patience and compassion for that person who's just experienced something that is unpleasant is a great idea. And as I said, these folks may experience headache, nausea, and vomiting. They may be aggressive. Like I said, they went from being very high into very withdrawn within 3 minutes. And those symptoms will wear off as the naloxone wears off. So they're not going to stick around forever. That's something that can help encourage folks to be patient. This is only temporary. It doesn't last more than an hour. Another thing that folks often want to do after they have received Narcan is they want to use more drugs because they want to get out of that withdrawal because it is really painful. And so we want to discourage that, obviously, because those drugs, it's not like they're going to go away. They're not going to get the person high for the time being, but they are still going to be in their system after the Narcan wears off and can send them back into overdose. So tell people, don't waste your drugs. You're not going to get high from them. Hold off. Wait at least a few hours. See how you're feeling better. And as I mentioned earlier, opiate effects tend to be longer than the effects of naloxone, so just making sure that somebody either receives medical attention at a hospital or clinic or staying with them for a while, or having a friend or family member stay with them, just making sure that they're not alone and they're not using in the few hours after naloxone is administered. All right, that is it for me. Anybody have any questions? Yes.
Hi, thank you so much. I had a question about the rescue breathing.
Mhm.
In the most recent CPR training that I went to, I recall learning not to do rescue breaths and instead to do chest compressions, particularly if you don't know the person and don't have like a mouth guard or an ambo bag. So I'm just curious if you could speak more to that.
Yeah, absolutely. So in the kits that you received today, there is a mouth protection piece that you can use. It's a little face mask. You put it over their mouth. That way you don't have to have direct contact with their bodily fluids. Obviously, nobody really wants that. There's also gloves in there too if you would like. So those two things are there. The reason that we teach rescue breathing is because it's a much simpler thing for lay people to pick up. If you are CPR certified, obviously, please do CPR if that's what you feel more comfortable doing. But in terms of getting oxygen into somebody's brain, lay people, it was decided that this is the best way we know how to teach. And perhaps you can speak to that a bit more, Amy Jo.
I'm going to add to that just a little bit. The difference between rescue breathing for someone that's had an opioid overdose and including breathing in CPR is that in order to encourage more people to not only do CPR, but the CPRs that aren't related to respiratory arrest, there's still a lot of oxygen in that blood, and by just circulating it with compressions, we're able to keep circulating that little bit of oxygen that's in there. When someone is in respiratory arrest because they don't have the ability to breathe because of the opioids, then the only help for them at that time is rescue breathing. But at any time, if you don't feel safe, hands-only CPR is always the answer, and call 911.
Well put.
Coming over.
She's coming.
I don't need it.
I'll repeat it, Amy Jo.
Is there a way you can elaborate a little more on that one question when you did the myths and facts about longtime users being more affected by opiate overdoses than Other.
New users, yeah. So the question was if I could elaborate more on the point that was made earlier in the myths and facts section about why long-term users are more susceptible to overdoses versus new users. So long-term users tend to have more of a routine with what they're using. So the amounts, their suppliers, when, where, what method, all that stuff. So long-term users also tend to have substance use disorder instead of being more casual users. So when you have those things, then you add in a change in supply. Maybe they go to jail, maybe they go to rehab, and their tolerance goes down. That's when you run into problems. With newer users, there's, I think, a bit more experimentation in a way. And with long-term users, it's just more of a habit and they're using more frequently. Yeah, and excellent point. People are more careful when they're new as well. Yes.
So this is kind of a comment. So and correct me if I'm wrong, is it true that so you need to wait the 5 minutes after the first dose, because if you administer the second dose too soon, then you've just wasted that dose because it doesn't do any good whatsoever, right? And so if you had to, you use them both too soon, now you're without the other one. Is that right?
No. Actually, it's more like you want to make sure. So it's proportional, essentially. So the more you give them, the harder the withdrawal is going to be, and the more awful it is going to be for them. So we want to give them the least amount that we possibly can, because that's going to make their experience much more pleasant. So basically, you wait 5 minutes just to give it a little bit of time to work. If you gave them both right away, like if you saw somebody and take a huge amount of something, then you could administer them both right away. They'd work twice as well as one dose. But the timing is more just, I mean, so you don't like waste a dose if they don't need it, but it's also for the benefit of the patient.
Okay, then I also just kind of want to add to that I just want to shed light on the fact that 5 minutes is a very long time in this situation.
Absolutely. Any other questions?
There's time. All right.
All
Lily,
right.
thank you so much for all
Thank
that
you, guys.
information.